Hello and welcome. Today we're going to discuss a condition that affects balance and vision: central vestibular disorders, specifically those arising from conditions like stroke and multiple sclerosis. Central vestibular disorders in this context stem from damage or disruption within the central nervous system. Strokes, which impede blood flow to the brain, can damage vestibular nuclei and pathways. Multiple sclerosis, an autoimmune disease, attacks the myelin sheath protecting nerve fibers, leading to lesions in the brainstem and cerebellum, disrupting vestibular function. Less commonly, brain tumors, traumatic brain injuries, and certain neurodegenerative diseases can also be causative factors. The vestibular system is a complex network responsible for maintaining balance and spatial orientation. When a stroke or MS lesion affects the brainstem or cerebellum, it disrupts the normal processing of vestibular signals. This leads to a mismatch between what the inner ear is sensing and how the brain is interpreting that information. This mismatch manifests as dizziness, vertigo, and difficulty with balance. The brain attempts to compensate for this disruption, but in many cases, complete compensation isn't possible, leading to chronic symptoms. Specific pathways and nuclei that may be affected include the vestibular nuclei themselves, the flocculus and nodulus of the cerebellum, and pathways connecting these structures to the cortex and ocular motor nuclei. It's difficult to pinpoint the exact prevalence of central vestibular disorders due to stroke and MS, as these figures are often included within broader statistics for dizziness and balance problems. However, studies estimate that a significant percentage of stroke survivors experience vestibular dysfunction. Similarly, a considerable proportion of individuals with MS report dizziness and vertigo as symptoms. The incidence increases with age, reflecting the higher likelihood of stroke and age-related neurodegenerative changes. Those with uncontrolled risk factors for stroke, such as high blood pressure or diabetes, are also at increased risk. The signs and symptoms of central vestibular disorders can be quite varied and debilitating. The most common include vertigo, a sensation of spinning or whirling, and dizziness, a general feeling of unsteadiness. Patients may experience imbalance, making walking difficult, and may be prone to falls. Visual disturbances are also common, including nystagmus, involuntary eye movements, and oscillopsia, a sensation that the world is moving. Other symptoms can include nausea, vomiting, and cognitive difficulties such as impaired spatial orientation and memory problems. Unlike peripheral vestibular disorders, central disorders often present with symptoms that are not easily suppressed by visual fixation and may involve purely vertical or torsional nystagmus. Diagnosing central vestibular disorders requires a thorough neurological and vestibular examination. This often includes a detailed medical history, focusing on the onset, duration, and characteristics of the symptoms. Neuroimaging, such as MRI or CT scans of the brain, is crucial to identify lesions caused by stroke or MS. Vestibular testing, including tests like the VNG of videonystagmography and caloric testing, helps assess the function of the inner ear and central vestibular pathways. Specialized tests like the video head impulse test, HAT, and cervical or ocular vestibular evoked myogenic potentials, (VMPs), may also be used to differentiate between central and peripheral causes of vestibular dysfunction. A key diagnostic feature of central disorders is often the presence of nystagmus that does not follow typical patterns seen in peripheral conditions. While there isn't a single, universally accepted classification system for central vestibular disorders arising from stroke or MS, they can be broadly categorized based on the location and extent of the damage within the central nervous system. For example, a stroke affecting the lateral medulla might result in Wallenberg syndrome, which includes specific vestibular symptoms alongside other neurological deficits. Similarly, MS lesions in the brainstem can lead to a range of vestibular presentations, depending on which pathways are involved. Treatment and management of central vestibular disorders is multifaceted. The primary goal is to address the underlying cause, such as managing stroke risk factors or using disease-modifying therapies for MS. Vestibular rehabilitation therapy is a cornerstone of treatment, helping patients retrain their brain to compensate for the vestibular deficits. This therapy involves exercises to improve balance, coordination, and gaze stability. Medications, such as antiemetics for nausea or medications to suppress vertigo, may be used to manage symptoms. In some cases, psychological support, such as cognitive behavioral therapy, can be beneficial to help patients cope with the chronic nature of the condition and any associated anxiety or depression. Preventing central vestibular disorders due to stroke primarily involves managing modifiable risk factors such as high blood pressure, high cholesterol, diabetes, and smoking. Regular exercise, a healthy diet, and maintaining a healthy weight are also important. For individuals with MS, disease-modifying therapies can help reduce the frequency and severity of relapses, potentially minimizing the risk of vestibular involvement. Preventing traumatic brain injuries through measures like wearing helmets during sports and using seatbelts in vehicles is also crucial. The prognosis for central vestibular disorders depends on the underlying cause, the extent of the damage, and the individual's response to treatment. Some individuals may experience significant improvement with vestibular rehabilitation therapy, while others may continue to have persistent symptoms. Recent research focuses on developing more targeted therapies for MS to minimize neurological damage. Studies are also exploring the use of advanced neuroimaging techniques to better understand the mechanisms underlying central vestibular dysfunction and to guide treatment strategies. Furthermore, research into novel rehabilitation techniques, including virtual reality-based therapy, is showing promise in improving balance and reducing dizziness in patients with central vestibular disorders.